you have your daughter, you fear to tell relatives, my girl is using substances, you know, because you expect
We have lost Doctor.
The presenter is lost. Network over.
I think it's going.
The substance has removed you.
No, that is not addiction.
It says there is live streaming. I think that could account for the interruption. Does live streaming create that kind of interruption, President?
Maybe it is a network issue.
I hope it is not data.
Live streaming will not.
It's the live streaming that always does that.
Why
And you may
that
find
not be
he's
a
serious
problem?
presenting.
No, not live streaming. Always
Live streaming doesn't. It doesn't
Judge, I'm
affect.
sure why didn't that be a problem?
Please indulge with us. He will
But
be
we are
plugging in a
always
short
we are
while.
always enjoying so live
He has got
streaming. I don't think is a
Gantoloze for
problem.
women.
The male
The network is fearing women.
There is no network in Ruka.
It is not fearing, it is respecting.
James, the son of James, you need to put a law to ensure that there is network.
out.
Next to Ruka and there is a network.
There's network in Ruka.
How are you?
Fear women. Abasajja be bamugyeko after he has said that it is for women today.
By the way, when are we on DNA?
That
We need to
gender
talk
is
on DNA.
special. That gender is special.
Yeah, that's very true.
And when you attack that gender,
You get problems.
Yes, ladies and gentlemen, I'm sorry. Hello.
Welcome back, Dr. Grace.
Thank you so much. Thank you so much. I think the one who was recording, there was an interruption. Okay, so let me enlarge the screen. Sorry for that. Okay. All right, so I was looking at high stigma and then experience more violence. You know very well women experience more violence. And that's why I'm focusing on women. When men go home, they are really violent to their women. Then women are less likely to receive treatment for substance use disorder, lack of access to gender-specific treatment, and are being incarcerated at high rates. So while gender itself may not predict treatment outcome, I wouldn't say when women are into treatment, they will get better, relapse rates are low, but there are gender-specific factors that influence treatment outcomes in women. So we have to be very, very careful of that. And you should join me so that we fight for a woman who is using substances. Why focus on women? Gender equality is a right. Women also have to be considered in treatment. Women are not only more affected by problems, but also possess ideas and leadership to solve them. You know very well, gender discrimination holds too many women back. I'm sure now women have started to come up. They hold very good posts nowadays. I think they're a little bit raising the bar high, but also there are areas like in mental health that women have been put down. Women's access to care, women's access to treatment is full of stigma. Women experience substance use disorder in somewhat different than men. This is what I'm going to tell you. When you start using substance as a man and a woman, the way we experience the effects and the way we get into this is very, very different. That's why there is a specialty. That's why I tried also to specialize in clinical care for only women. So treatment is different and care is different between men and women with mental disorders and substance use disorders. Women and girls make up a third of people who use drugs in the world. That is very well in the recent report. 3.8 million of women are estimated to inject substances. Currently, I want to tell you that in Butabika, we are hosting a clinic called MAT Clinic, and we have about 400 patients that come in every day to receive methadone, to receive what we call MAT. MAT is medically assisted treatment, and most of these are women from ghetto. Most of these are girls and young boys. But I mean, they come to receive maintenance dose. So these are women, these are boys and girls that have failed to get better. So we decided to put methadone, so they walk every day to come for treatment for 360 days.
When they were giving you five.
Some subgroups of women have higher rates of injecting drug use. It is very common now in Kampala, mostly even among the medical workers. So many are injecting drugs. 6.3 women have amphetamine use of disorder, and 4.7 million of women have an opioid use disorder. This one we shall discuss more when we get more time. 2.1 million of women use cocaine disorder. There are so many that are using cocaine. You have your daughter at home, you don't understand, her behaviors have changed. You even don't wonder, the performance was good, but you see decline in performance. You see your daughter who was good in school, there's a lot of decline. But I mean, you may not even know if she is using substances, because some of these substances literally don't smell. We have the ice, we have the shishas. Nowadays, you see university girls are in bars smoking. Those who have been to bars, you've seen this. They are smoking cigarettes, they're smoking marijuana, they're smoking shisha, they're drinking themselves off. But I mean, they are vulnerable. That's one word I want to put across. Women are very vulnerable, as I'll let you know in my slides. I can continue. Telescoping is one word I want us to briefly know as Rotarians, because we are elite people in here. What is telescoping? The amount of time between the initial use and the development of physiological problem is shorter for women than in men. I know Jaja Mzungu will ask me why, and I'll answer that question. That when a woman starts using substances, the time, the initial use and development of a physiological problem is shorter. So a woman easily gets physical issues than men. Women easily get addicted than men. Women easily get into substance use than men. But remember, I said they are very vulnerable. They are very, very vulnerable. The amount of time between initial use and the severity of the problem that developed from use of alcohol and drug is shorter for women than men. That is telescoping. When you start having a bottle of beer, now a woman will get drunk faster. That is science. I can tell you that later. When you start using substances, mostly these drugs are introduced to women by men. You'll ask me why. It's very true. Substance-related health issues in women, use of illicit drugs stress the human body, true for both women and men. However, women have some different physiological responses to drugs and greater risk for health-related issues. Remember, they are pregnant women who use substances. Remember, women have a lot of, they go into a lot of menstrual cycles, as we shall see. Physical effects of women experience negative physiological consequences sooner with less use than men. As I said, women have more medical, psychiatric, and social consequences of substance use. Women easily get into substance. My time is running away. And women have more medical physical problems. Treatment needs of women are different than men. Coexist psychiatric disorders, parental stress, trauma. Women go through a lot of trauma. In most cases, the women, the girls and ladies have interfaced in clinic, have interfaced in substance use problems, have undergone through trauma. that one I can whisper. So don't just say, why is my girl using substances? Why is this woman starting using substances? Why is this my wife? In most cases, research says almost a bigger percentage of these women that use substances have gone through traumatic experiences, have gone through traumatic events, either childhood traumatic event, either sexual abuse, either violence in home, or they have been totally, dismayed by their husbands. They feel life is not good, so they get into depression, which I'll look at as a comorbid for mental disorder. So they tend to resort to using of substances as a catalyst. They tend to resort to using of alcohol just to escape away from the problem, because they know if they went back home, things are not fine. They know if they recall, trauma is a very, very worst experience. Rotarians, if someone is undergoing through traumatic experiences, it is the worst. Briefly, trauma is the experiencing or possibly having vivid nightmares or having experienced a very, very bad event. And you get the effects mostly after 2 months, like nightmares, like, worry, not sleeping at night, waking up most of the time, and a lot of anxiety. In some countries, fewer women than men overdose. Recently, we have registered a lot of overdose in Uganda. For us who are in substance use area, many girls have died in ghetto areas. Many girls have died. There is also suicide. Increase in suicide has been registered. Alcohol is one of the 5 leading causes of morbidity and mortality. Now that we are talking about women, we have to be very careful. When women use drugs compared to men, women are more susceptible to alcohol-related organ damage than men. Remember, when a woman is pregnant, that's when they'll come up with a baby with fetal alcoholic syndrome. Most of our wives do alcohol when they are pregnant. I remember sometime in the village, people say, no, when you take alcohol, you give birth to a brown baby. No, that baby is malnourished. I want to tell you, Rotarian is here so that you can psychoeducate those who drink, women who drink when they're pregnant. That's why we have more of, you give birth to a baby who is have low intelligence, the baby with, very poor immunity, baby with a big head. It is fetal alcoholic syndrome that causes that. Experience and increased severity, greater numbers, and faster rate of development of health-related complications. Women develop alcohol use disorder in less time than men. As I said, telescoping. That is science, and I can let you know about that when women do substances, the effects are faster. Even they get high faster, they get drunk faster. But remember, I said most of these drugs have been taught to women by men. Mostly cocaine use, injecting drug use, even alcohol. In most times, it is let's go out. Please have one. Can you just have one Tusker? Our university students have landed plea. Can you take just one Smirnoff? Don't worry, take one cigarette. And Bambi, they are too vulnerable. So I have come up to say, no, I should fight for a woman who has substance use problem and mental health disorder. It's really bad. I would tell you something also, that when women do these substances like cocaine, in most cases when they go, they are pregnant, they give birth to babies, and these babies suffer the withdrawal symptoms. By the way, most of the babies have died, have passed on, at birth because of withdrawal syndromes, because of withdrawal symptoms from substance use. This baby withdraw from heroin. This baby is withdrawing from cocaine. This baby is withdrawing from alcohol. But just because maybe the clinicians didn't assess if this woman was on a substance when she was pregnant, the baby ends up dying. And that's why the numbers are also escalating for babies who die at birth. So that is a very good caution for the medical personnel who are in this chat today, that whenever you have a pregnant mother, whenever you interface with a pregnant woman, the most important thing to do is assessment for substance use. I've seen so many that have lost their babies and the effect have been substances. This woman has been on alcohol frequently when pregnant. This woman has been on cocaine. This woman has been on amphetamines, has been on medicinal drugs like sleeping pills. And then at birth, babies suffer from withdrawal. And then they say, normally say, obuoka, something like that. I think Kibed knows that in Usoga. Literally, the baby is withdrawing. So stimulants and health effects on women, hormonal changes across the menstrual cycle have a strong effect on stimulant drugs. The phase of menstrual cycle matters. Overall, women who use cocaine reports more positive subject. What do I say here? In most cases, women who use methadone, who use drugs, have menstrual abnormalities. Daddy, I've not gone through periods for the last 6 months. Daddy, I've not gone through periods for the last 1 year. When women are using substances, it affects their menstrual cycle. Some women don't go into menstrual, by the way, they don't menstruate. So the effect is substance. Deficit in sexual desire, performance also declines when a woman starts using substances. In the beginning phases, their sexual libido is high, very high. When someone starts alcohol for the first time, 1 Smirnoff is taken, two alcohol, 2 cig here and there, she is taken. But when they continue to use, because substances continue to stimulate a lot of hormones, that with the time causes depletion, so that lowers the sexual desire and libido. So in most cases, when a woman is on substances, is that she doesn't care. She's not into that. She's not into sexual. She's just into substances. And that one we shall discuss when I come to men. It is worse. You'll end up taking a lot of things, a lot of nondo, but it will not work because there is depletion of hormones. Then we have amenorrhea, and other symptoms often make women believe they are permanently sterile. Amenorrhea is called, they bleed, the bleeding. Sometimes when they go into menstruals, they continue to bleed for a long time. They have heavy periods. They bleed like nothing.
Rotarian, Dr. Grace, please summarize.
Yeah, thank you so much, ladies and gentlemen. There's a lot to discuss about women and clinical care for women with substance use disorders. My president has ordered to summarize, and surely I have to respect her because the order comes from the president. Post-traumatic stress disorder is very important when we are dealing with these women. Women have gone through PTSD. Women with PTSD and substance use disorder tend to have poor treatment outcomes because they have a lot to deal with, and these comorbid. So, ladies and gentlemen, I do appreciate. Thank you for listening. Because of time, I beg to end there, but let's appreciate that women are more vulnerable, and let's fight for women. Let's really help a woman who is suffering from substances. Join me, join the group, we fight for women. I welcome you. For any answers, for any questions, I am ready to answer. Thank you so much.
Thank you, Dr. Grace, for the information you've given us about substance abuse. I'll welcome the body group leader, A.G. Frederick, to come and take on the QA. Thank you.
Thank you, President Dorothy, and thank you very much indeed, Rotarian Grace, for doing justice to your classification. Friends, time not being our best ally, my prayer and request with your indulgence, President, is that we proceed this way. Number one, we are going to take only 4 questions for now, and we'll pack the rest. I'll request you, Dr. Kumbi, to stay put after the fellowship so that we can be able to carry on to respond to most of the concerns after the gymnasium. So I'll request that I'll take two questions from the chat room and 2 hands. And then, unfortunately, today I will not take Bachiga. Bachiga will let it the Chimeza session. So 2 questions in the chat room, and then I will take 2 hands. And I will straight away pick the questions from the Chimeza as I come back to the hands. The first question from the chat room comes from amazing President Edward. And he asks, what treatment approaches are appropriate and feasible in the local setting of these addicts? I repeat, what treatment approaches are appropriate and feasible in the local setting of these addicts? And the second question is from Hope Greater President Farida. What would be the cause of mental health issues in women during and after pregnancy? I'm tempted to add this. How do you advise women who drink while breastfeeding? I am tempted to add that, seeing that there's only 1 hand, which I will pick from CP Kayunga, CP Joseph from Kayunga. Please unmute and shoot your question.
Yeah, thank you, moderator. This is not from Kayunga. My name is Kayunga Joseph. I'm the charter president of Nagarama Rotary Club. The presenter did not complete her presentation, his presentation. And then I'm asking, do we think we shall have a recap of this? And I also want to request the presenter whether I can accept my invitation at our fellowship. We always fellowship on Fridays, 6:30 to 7:30. I beg to submit. Thank you, sir.
Thank you very much. I think I will let that question go to the president. Will we have the presenter back, given that his presentation has been cut short? 2, can you allow him defend his classification in other clubs? I will not take that to you. I'll send it to the president. I'll pick only 1 hand, 1 question for you. Do you have data from Minister of Health about this subject? That is something you can respond to. Dr. Safina, I think being a woman and a Nalong at that, I think it is only fair that I allow you 30 seconds to voice your question.
Thank you very much, Hope Greater Asante Governor Frederick. For sure, 30 minutes will not be enough. I don't want to lie to you. I have many reasons for me to submit in this, but for now, let me take the education arm of it. When Dr. Bikumbi was presenting, he even said Divambi, there were younger girls and so on. And now I'm relating to schools in our communities where these girls that are going to become women are. And the strategies, Dr. Bikumbi, you have a clinic in Butabika Hospital. Do you have community outreaches? Do you visit schools and the rest to spread the gospel of this danger? Because when you talk to the stages, experimentation, and indeed the stage of adolescence is a stage for experimentation. They will be taken into, because they don't know they are being influenced by hormones, they are not used to that status and so on. So I just want to find out whether you have a community outreach. And then secondly, being a midwife, you talked about not being able to recognize that this client is addicted, and then we lose the baby at the end of the day. Do you have a program for midwives when they are during training to see that, or have you looked at the curriculum for midwives to see that this component is included? I submit, Chair.
Thank you very much. Over to you, Rotarian Grace, to please respond to those questions in the shortest time you can. And then I will beg you to kindly stay put for a few minutes after our engagement so that we can take more questions in the Chimiza session. Yes, Grace.
Thank you so much. I think Dr. Safina and the rest. The first question was, what would be the cause of mental health issues of women during and after pregnancy? The first cause is distress, stress. When a woman is pregnant, and in most cases is going through a lot of fights, she's going through a lot of violence, she has a lot of financial issues, unemployment, and a lot of thoughts. I mean, psychological distresses can lead. When a woman is pregnant and she's going through a lot of psychological distresses, there are higher chances of this woman getting mental-related disorder after birth. After giving birth to the baby, they become aggressive, they become angry. And because of also the pain that they are going through, so relating that pain, the psychological pain and the physical pain makes a woman go through a lot, and in most cases they go into major depression, others go into muting, they just keep quiet for even some good time. Others become aggressive and angry to the babies. Others even, I think, normally people say a macho, something like that in Uganda. The woman wants to eat the baby, wants to actually strangle the baby, so she gets into a mental disorder. So a lot of issues surround that area. When a woman has gone through a lot of distresses, a lot of fights, a lot of financial worries, I mean, being oppressed by a man when pregnant. So this is one of the causes. It is just one of the causes, as we can exploit more in another session. What is advice for women for, breastfeeding? Well, it's not advised. If you're breastfeeding, the advice is don't breastfeed while having substances, while drinking, because this will affect the development of the baby. You'll not give the quality breast. Accept my presentation. I think through my president, possibly she'll allow me to say that I can present your club. Otherwise, as a Rotarian, I'm very ready to present your club for any topic that is related to mental health disorder, mental illness, or psychiatry, or clinical, or psychological. I am ready to present to your club, any club that can invite me. Data from Ministry of Health. This is purely new. And in most cases, I would tell you in Uganda, I am the only at the moment who has gone ahead to study more about women with substance use disorder and clinical care. So, but we are just starting to do research to see and also put data at the ministry. You might not get data at the moment because it is still raw data. But we are working hard as academicians, as scholars and practitioners, so that we really put data, because this is happening and that research has been started on. Data from Ministry of Health here. Do you have community outreaches? I will want to tell you that we have a few community outreaches, but because of the financial issues and budgets of the hospital, purely this is not so much. The outreaches are few, and maybe this is now the Rotarians can come on board, since we're in mental health. This is for mental health. Maybe can come on board and put outreaches in schools, outreaches for women, and who use outreach for these girls, young girls in schools, in high institutions and universities, so that we can help them to overcome the problem. Then lastly, do you have a program for midwives? Dr. Msene, I don't think we have a program for midwives, and possibly this is the time that we can engineer this. Purely everyone who would want to join me, this is purely very new, and I'm looking at maybe forming or starting a rehabilitation center for only women, because as I finish, mixing men and women into treatment is also a problem for substance use disorder. They went into trauma, past substance use. When they come into treatment, men continue to violate them. Even when they're in one substance use disorder unit, there's a lot of now relationship, disorganizing their treatment and recovery. So there's a lot to do Join me. Let's fight for this. Let's fight for women. Let's fight for future Uganda. I thank you and I beg to submit.
I thank you, Rotarian Dr. Grace, for the presentation. It's awesome to hear you're passionate about the women, and I believe the women in the house have heard. I'd like to invite Rotarian Jane to give a vote of thanks. Sorry, was I muted? I was saying thank you, Dr. Grace Bikumbi, for the awesome presentation.
We had you.
Okay, that's nice. Okay, I invite Jane to give a befitting vote of thanks.
Thank you very much, President. I am taking it on that it is Jane me, not any other Jane in the house. It's been an amazing presentation. Dr. Grace, nobody could have done it better than you. The passion you have for the women, the care and all that you've done and all that you keep doing, and to make us shine and really see someone is behind us. It's really wonderful. Thank you so much for giving us your time and sharing with us your knowledge. Merci beaucoup is all I can say, and God bless you. Thank you so much, Dr. Grace.
Thank you so much,
Rotarian Jane. And I'd like to request Sergeant at Arms to give us some 5 more minutes to conclude the Rotary norms, and then we go to Chimeza. Can I take 5 minutes? Rotarian Takia.
Thank you very much, President. I hope I'm audible.
Yes, please.
We had 155 participants in this fellowship, and we had 36 Rotary clubs, then 39 guests. In the Rotary clubs, we had Rotary Club of Kampala Impala, Rotary Club of Stacey Islands, Rotary Club of Sonde, Rotary Club of Saturday Ijaz, Rotary Club of Nakasero, Rotary Club of Bukoto, Rotary Club of Bwebaja, Rotary Club of Kampala Alibad, Rotary Club of Kampala Sunrise, Rotary Club of Wakiso, Rotary Club of Boyogoro Nambole, Rotary Club of Ntinda. Sorry, let me get louder. Wait a minute.
Sorry?
Am I now louder?
Yes, you are.
I hope I'm louder now.
Yes, you are. Go ahead.
Okay. So, Rotary Club of Boyogoro Nambole, Rotary Club of Wakiso, Ntinda Metro, Rotary Club of Kampala Metropolitan, Rotary Club of Upper Kololo, Rotary Club of Nagalama, Rotary Club of Kira, Rotary Club of Chiwatule, Rotary Club of Chengera, Rotary Club of Maisha, Rotary Club of Kampala Muyenga, Rotary Club of Akasha Sunset, Rotary Club of Machindia West, Rotary Club of Mbarara Ranchers, Rotary Club of Natete, Rotary Club of Kansanga, Rotary Club of Muyenga Breeze, Rotary Club of Semuto, Rotary Club of Kampala North, Rotary Club of Nakawa, Rotary Club of Mengo, Rotary Club of Kampala Springs, Rotary Club of Mbarara, Rotary Club of Bwebaja, Rotary Club of Chadondo, Rotary Club of Kololo, and Rotary Club of Mutondwe. Then we had 22 daybreakers on call. I submit, President.
Thank you, Rotarian Takia, for the statistics. If your club has not been mentioned, please put on the chat so that we can capture. At this juncture, I would like to invite Rotarian Rugerisa to give us the final toss.
Thank you, my hope-creating president. Good morning, Rotarians and all guests on call. To the wonderful incitement we have received about women's mental disorder and how it can be managed, and the more yearning we've received to have more information, I'm proposing that we toast to Rotary International.
I thank you so much for attending this fellowship, everyone who has been in the house, the Hope Creator presidents who have been in the house, the assistant governors who have been attending, the CPs, the amazing presidents, and not forgetting our immediate past governor who was in the house. Thank you for coming. Thank you for visiting Daybreak. We are now going for a Chimeza. I hand you over to Assistant Governor Frederick. I thank you.
Thank you very much, friends. For those that would like to leave, it is well. You could take your leave, but I will otherwise request to stay put for only 23 minutes. At exactly 8:30, we'll be calling this to a close. So I just want to check and confirm whether Dr. Bikumbi is still with us. Are you still there?
I'm still in the chat, thank you.
Wonderful. Good. So I would advise that you leave the chat to me and attend to these questions that come from colleagues. Friends, I will request to quickly pick the questions in the chat room, but I will allow you, those who have hands, to really voice your questions. Just a moment. I want to pick it up from where I left it. Yeah, there's a question that you did not answer. What treatment approaches are appropriate and feasible in the local setting of these addicts? That is a question from Amazing President Edward. Then there's another question. What could be the cause of these cases in expectant mothers? That is another question that you did not miss, you did not answer.
Sorry, which question is that? I beg your pardon?
The question is, what treatment approaches are appropriate and feasible in the local setting for these addicts? Okay, that is one. And then number two, what would be the cause of mental health issues in expectant mothers? That is the second one. And then another question is, are there cases where these affected women beat up their spouses and children and others? Elizabeth is asking for your Twitter handle. I don't know whether it is appropriate to ask a man from Ruka a Twitter handle. Please share the slides. We'll be able to pass them to the colleagues. And then you have an offer from Dr. Hamza Musa from the Rotary Club of Kampala, Kampala PAMS, and he is offered to help you through their psychosocial division at the Ministry of Health to match this very important subject. So I will share with you his number. You can take it on at an appropriate moment. And the question is, I see I must not leave out the words of appreciation. There are quite a number of them saying thank you, timely presentation. So there's a lot of thumbs up for this particular subject. Okay, allow me turn back to the voice questions. If you do have a voice question, I know that I saw a hand. I think it could have gotten tired, but it was from Rotarian Fiona. Oh, no, Peruth. Peruth, please voice your question.
Yes, my question, thank you so much, Frederick. My question to Rotarian Grace is, It's about rehab centers. I want to really know what happens in these rehab centers because I have a person close to me who has been in rehab, in and out of rehab for almost 2 years. He's there for like 2 months, 6 months. They get out thinking they've gotten better. Then after a month, the situation gets worse. They take him back, they take her back. So I really want to know the dynamics of rehab. Is it the best option for these addicts? Are there better ways of recovery? What exactly happens in there? Thank you so much.
Thank you very much. Maybe I'll give you a rejoinder. Is there a treatment for stress? Maybe you can start with those, and then we'll take another set.
Much for those who have remained a little bit in Chimeza, to spare a little time, continue with some of this presentation. Approaches for appropriate is the approaches appropriate and visible for in the local setting. Yeah, surely the approach for treatment is very clear. I think the most important approach is you cannot do treatment outside hospitalization, outside treatment center. Why? Because when someone is into substance use, the first stage we do is detoxification, is removal of substances from the body through medicine. We apply treatment, the clinicians will apply treatment that will help replace whatever you have been using or doing. So that approach is very clear and feasible, that someone has to go into a proper setting or maybe see an expert, reviewed by an expert, a mental health expert, a psychiatrist, a clinical psychologist with experience in substance use and treatment. So the other side I would say is, as I said, the stigma. Stigma, most people have stigma to access care. And if you come to Butabika, the name itself, many people don't want to hear that word Butabika, but this is a hospital in a village of Butabika, and the care is very, very appropriate and very good care. But also people with substances or who use drugs don't appreciate that they have a problem. So in most cases, there is involuntary. So it doesn't mean that treatment has to be voluntary to be successful in substance use and mental health. That's why you see people are taken by force, people are dragged into treatment by force, but because at the stage in the community, they cannot appreciate that they are sick. But you have to know that someone whose occupation has been impaired, someone whose maybe social functioning has been impaired, the family has been impaired, and nothing. They are aggressive even at one point. They are a danger to society and their lives and healthy. So they have to be taken into treatment for care. So it doesn't mean that treatment has to be voluntary to be successful. Sometimes there's involuntary treatment. So that someone can be coerced into rehab, then the treatment starts from there, the counseling, the psychological interventions and all that. Causes of mental health issues in mothers, I think I discussed about that. There are so many, it's not one single factor. There's environmental cause, where the mother is exposed to a lot of stress, as I said, a lot of violence, a lot of financial constraints and all of that, unemployment, and then she's not even having nice meals. So there's a lot that explains that, apart from genetic factors, predisposing factors. Are there cases of women beating up men? True, they're there, but today it was for women. Men, women, some women, surely, women go and do substances and they beat up men. I mean, they fight, but sometimes you see that men become more aggressive and more violent. So they'll end up injuring this woman who has started a fight, because men are naturally strong. They're naturally energetic. But the fact is you've seen these cases when women have cut off men's private parts. This has been common. A woman cuts off a man's private part. Most times when she's drunk, she comes and there's a lot of violence in home. So true, they're there. I can't say they're not there. Are there cases, about rehabilitation centers, in and out, in and out, in and out? I think the answer will be addiction. If someone is into treatment and addiction, addiction is a disease. And what I want to tell you that is somehow distressing to anyone who would not want to hear this is addiction is a relapsing disease sometimes. Why? It is chronic in nature. If someone becomes addicted, it's chronic somehow in nature. So the most important thing is management. But people get better. People get off these substances. But because of the science surrounding the limbic system, surrounding the limbic system, that when you start doing something, maybe a little thing I'll tell you that if you do something that is so nice and it creates a lot of pleasure in two neurotransmitters, major dopamine and serotonin. Those are two major neurotransmitters for pleasure. So an individual would want to do that thing again and again and again. That is a point note, that if you do eat some nice food, you do alcohol, you do a substance that makes the pleasure, the transmitters, dopamine raise higher, you would want to go for that particular thing more and more and more and more. So the only thing we do is to help you to cut off, to help you to stop, and possibly don't even test. So sometimes, yeah, there are relapses. And also maybe it depends on the treatment that is given. As I said, women, care for women is not comprehensive. So we should take to people who really have care, expertise in caring for women with substance use disorder, because you might find that a lot has been not touched. Maybe this girl didn't disclose a lot of issues that are psychological, trauma, a lot of violence, childhood development. So if she does not do that, and alcohol is like a coping mechanism, substances are like a coping mechanism. So if she doesn't do that and goes back to the community, she's very able to repeat the same habits over and over and over. So there's something that needs to be done on that particular patient. Is there treatment for stress? Yes, treatment for stress is there mostly. I think it may not be tablets, but it's more psychological. Thank you so much.
Hey, thank you very much, Dr. Bikumbi. I think it is right about now that I want to take the colleagues with hands, and there are three. Number one, I will take your hand, CP Joseph Kayunga, followed by Eddie Mupende, and lastly, Hope Creator President Farida. In that particular order, precisely voice your questions.
Thank you very much, Sebo. I have so many questions because this is a very important topic. Kindly, doctor, share your number so that I take the opportunity to invite you to our club. This is a very important topic. I don't know whether I can put my question forward because of time. I have a case whereby in one, my child is a grown up. Is not very old, but to me, I think she's already grown up. She's in P6. She was not urinating on bed. And I think now her mind is a bit confused. She started urinating on bed late. She stopped urinating at the age of around 2. No, the mother tells me below 1 year. But now we discover within this class of P6, she has started urinating on bed. What could be her cause? Secondly, I have someone who is having a grown-up mind per se. All the time, this person, you look at this person is like, they are bewitching me. Maybe there is a problem. Maybe someone wants to kill me. What could be that kind of cause? Because these two cases, I don't see anything related with drugs. Thank you, doctor, for that assistance.
Eddie.
Okay, morning. Thank you, doctor. I just have like 2 questions. One is, there have been cases in these rehabilitation centers whereby you actually find that these people go for treatment, but actually when they reach there, you find that again, they're even able, I don't know how, but they're still able to access those substances. You find that either it is the staff or something, and then you wonder how these people are actually going to get treated when they reach there, and they can somehow, if they have money, somehow they can still access those substances inside the treatment center. And then also the treatment, I want you to tell us about the cost of these treatments, because I think from what I've discovered, it's a bit expensive going through the treatment. Please help us on that. Thank you.
President Farida.
Thank you, Past President Frederick. My question is, it doesn't necessarily have to do with substance abuse, but I have a person that's very close to me that got issues when they gave birth. They began zoning out. You'd be with them and they talk. It's like their reality is different from yours, and sometimes she would even get violent. She keeps going to the hospital and coming back, and she would be okay for about a couple of months, and then she's back in there. So I just want to find out, is it a common thing, and is there a hope that it can heal completely? Is there a way that she can get treated and doesn't have to go through the same thing again? Thank you.
Awesome. Dr. Chris, please respond to those in the few minutes we still have.
Thank you so much. P6, urinating in bed, and she stopped early, in early childhood. You see, there are changes in cycles, and this girl, what I would do is, since she has got this problem, she needs to see a clinical psychologist. There must be a lot of issues that she's going through that you are not aware and she cannot disclose. Hope I'm loud and clear. There must be a lot of psychological distresses that she's going through and you cannot even know. So the best way is kindly, this girl should see a clinical psychologist or psychiatrist for assessment, because this is sometimes unusual, and in most cases, she'll be trained by an expert on how to time herself. So she has been taken into sessions and time herself on how to stop. If it continues, it will affect her. And also with time, she's going to get depressed. If she grows, goes to secondary and she's urinating, goes to university, she's urinating, we are most likely to come up with secondary diagnosis, which is basically secondary depression, because she doesn't want the issue. So the earlier, the better. To me, in most cases, there are a lot of psychological distresses or issues that this girl is going through. So we need to address that. Okay, bewitching, this person is suspicious. In most cases, doesn't necessarily mean that someone should be on drugs to have mental health related disorders. This is besides the topic, but in case someone is suspicious, most times they say this one is bewitching me, this even doesn't want to eat with the family, wants to prepare her own food or his own food, always thinks people are against her. Even watching TV, people are looking at her. This is a mental-related disorder. And these people become paranoid. We call it paranoia in mental health. They are paranoid, so they need to access care. But I mean, when you talk with them, sometimes they are normal. For you, as a lay person who is not a mental health expert, you may say they are okay. They are very okay, but in actual sense, this illness has been growing slowly by slowly. So by the time these symptoms erupt, that means it is becoming worse. And by the time you don't access care, it is going to even turn into major mental illness, which is schizophrenia. So they are paranoid, they hear voices, they think people are against them, so they even become aggressive with time. So accessing care, seeing an expert is better, but they will not appreciate that they are sick. That's what I should tell you. But when taken to an expert, trust me, they have a problem. Go for treatment, but able to access substance. Yeah, these some patients or relatives who take their patient treatment centers, it is true. Just like in Rosita, these guys are in prison, but you wonder where they get the drugs. I mean, it's nature of, I don't know, setting, nature of people, unemployment. Sometimes workers in different rehabs, as Kalis, because some of these patients have money. Some of them are well off. They are from good families. So I find that an askari will be bribed to sneak a drug. And this is very bad. It's actually very, very bad and dangerous. You find that even these patients are very bright. People with substance use problems are very, very sharp. Sometimes they fetch drugs in any part of the body that you may not know, and he will keep using that drug inside the treatment. The most important thing is making these people appreciate that if we do treatment and getting well starts from you. So what do I mean? That a person has to accept that I have a problem. Otherwise, sometimes it's very hard to fight zero drug in a rehabilitation center. I wouldn't say any single rehabilitation center does this, but sometimes many rehabs, people access drugs, and that's very bad. Okay, then the cost is very expensive. I've been in very many countries all over the world. Treatment for rehabilitation of people with SUD is very expensive. Why? Because in care, someone has to be in 3 months and above, according to the World Health Organization recommendation, at least 90 days and above in treatment. Remember, this guy the mental state is okay, others, the mental state is not okay. But for someone to be rehabilitated, to do a lot of cognitive behavioral therapies, to make someone appreciate that I have a problem, it takes a series of time. So that's why when you go to rehab, they'll tell you 90 days, others tell you 6 months, others even 10 months. So you find that on one patient in 3 months, you're spending over 15 million. It is very expensive. That is very true. Either you come to the public hospital or private. Even when you come to private in Butabika, it is very expensive to access rehabilitation for people with substance use. So why they need a lot of expertise, a lot of clinical issues here and there. Detoxification is expensive, mostly for injecting drug users and those who use hardcore drugs. Okay, yeah, I think those are the questions that I had on the table. I beg to submit for now.
Thank you very much, Dr. Grace. For those that wanted Dr. Grace's number, I've shared it in the chat room. You could pick it up from there. I don't seem to see any further questions from the chat, and neither do I see any further hands. With that, it is only fair that I once again appreciate each and every single one of you for staying put and wish you a very fruitful day ahead. Thank you, Dr. Grace, for your insightful information. I'll give you one minute, just 1 minute. 1 minute, strictly 1 minute, to make mention of your parting shots. 1 minute. At 8:30, we are closing. 1 minute, Dr. Grace.
Thank you, Bade Rotarian Frederick Takuli, for moderating this. I thank you all. Let's fight for Africa. Let's fight for Uganda. Let's fight for the whole world. The world, I mean, substances is a lot. Drugs a lot. Our children are getting involved, and Uganda is a time bomb. Let's fight together to say that we help people with mental health related issues and also fight substance use. I beg to submit. Thank you. May God bless you and have a wonderful day at your work. Bye.
Wonderful, wonderful. My parting shots to you, Hope Creator President Dorothy, and you, Dr. Grace. This Rotary year, Rotary International President Gordon McNally encourages us to create hope in the world by working in 2 areas. Number 1, peace, and number 2, mental well-being. I repeat, number 1, peace, number 2, mental well-being. And mental well-being is actually one of the programs that the district is actually focusing on. My challenge to you, my humble prayer to you is, this is my heartbeat, this is what I feel, this is what gives me pulse. I feel that I don't know of any club that can beat Rotary Club of Kampala Daybreak in designing interventions, and not just designing, implementing interventions in mental well-being with this kind of experienced doctor expertise and exposure, where you're the only one in the country in some areas of specialty. So Hope Creator President Dorothy, I look forward to the Mental Wellbeing Award coming to Daybreak in Camden this year in Munyanyo. I thank you. May God keep each and every single one of you.
Inshallah.
Thank you, Mr. Kitakule.
Thank you very much. Hope President.
Thank you.
Thank you very
Thank you,
much.
Uncle Billy.
And
Thank
excellent.
you, Eji Fred. I've been online
Excellent.
and I'm the chair
Asante
for the
government.
mental health.
Oh, thank you very much, my friends
Good
and my
morning,
fans for
Hajati
being with us.
Safina. Good morning, Mr. Kitakule. Mr.
Yeah,
President.
Dr.
Good
Barun
morning.
is already on our list
Rotarian.
for the resourceful people.
So I was wondering, and indeed, AG Frederick is indirectly saying that Dr. Bikumbi should be beyond the club, because I was asking a question, who is our focal person for mental health, and amazing president gave me the answer. But let us work towards that.
Yeah,
And
Dr. Grace is already the focal person, is the champion for the mental health. He's already on the list.
And Dr. Bikumbi, you need to fight business as far as drugs are concerned. And I think that's where we get the problem. Oh, these victims that we are getting, it is because people are doing business in those drugs and they target where to do children. I have a friend who has his first child. He became addicted in and out of rehab homes and no improvement at all. So we need to move an extra mile. And it is good you talked about the unemployment. But maybe it may not be an issue of unemployment, maybe attitude, mindset, and so on. And all those are your issues, Dr. Bikumbi. I thank you and I request to go off.